Most of us know that mixing medications may have serious side effects, but did you know also combining certain foods with certain prescriptions can affect how well they work or don't work? Dr. Natalie Azar is an NBC News medical contributor. Dr. Azar, good to see you.
Hi, good morning, Tamron.
All right, so we're talking specific foods and specific classes of medications,
That's
right?
correct, yeah.
All right, let's start off with leafy greens. By all accounts, kale, spinach, those things are all good for us.
They're all fantastic for you, right? But they can interact with a medicine called warfarin, which thins the blood. It's used to prevent and treat blood clots as well as a couple of other conditions. The thing about warfarin is it actually counteracts the effects of vitamin K. Vitamin K is found in leafy green vegetables. Some of the biggest offenders would be spinach, kale, collard greens. So basically, warfarin and vitamin K work against each other. What does that mean for the patient taking it? If you're taking too much vitamin K and you're on warfarin, it's going to decrease how effective the warfarin is. But here's the rub. It's not that you can't eat vitamin K rich foods, but rather it has to be a consistent amount. Your doctor or healthcare provider is going to check blood tests on you to make sure that your warfarin level is therapeutic.
For example, in this case, is that listed on the prescription?
So a lot of times these things are listed in the prescription. It's also in the package insert, and probably more than anything, you're going to enlist the help of the pharmacist to teach you about these drug-food interactions.
Next
also
up on our list, ACE inhibitors.
ACE inhibitors and bananas. And the reason here, so what are ACE inhibitors? They relax blood vessels, which means they're good to treat high blood pressure as well as heart failure and a bunch of other things. But they can also affect the kidneys and cause a little bump in your potassium level. In people who have a lower kidney function or not normal kidney function, eating too many bananas, which are rich in potassium, could raise the level to a high enough degree that they could experience some heart rhythm abnormalities. This is easily offset or monitored by regular blood testing. This is something that most healthcare providers would be familiar with, of course.
Moving on to antibiotics and milk.
And milk. So I don't know, the group of antibiotics called tetracyclines, for example, people use them for acne. There are a couple of different classes of antibiotics where if you take them with milk or cheese, for example, at the same time, it'll block the absorption of the medicine and basically render it completely ineffective. Another example of a class of antibiotic is Cipro. I'm sure you've heard of that one too. And then there are others that you're allowed to actually take with milk. And the point here is that you just don't want to take it at the same time. You want to spread it out, the medicine with the dairy, a couple of hours.
And in this case, I've seen the label where it says do not take with milk. That's
very much in bold. That's a common warning, yes.
NSAIDs, which are pain relievers, and garlic.
NSAIDs and garlic. So NSAIDs, which stands for non-steroidal anti-inflammatory drugs, do just that. They reduce inflammation. They also treat pain. They also can function as an antiplatelet drug, which means it can also thin your blood. And guess what? So does garlic. So a lot of people take garlic for a variety of different things, cholesterol, heart disease prevention. Garlic can also thin your blood. So people who are taking garlic supplements and take an NSAID regularly could experience blood thinning that could be dangerous.
What about if it's just in your food?
So if you use garlic for seasoning, it shouldn't amount to that big of a clinical effect, but it's taking a whole garlic and a lot of it or a garlic supplement where you can get into trouble.
Last up on the list, grapefruit.
Last one is grapefruit. Grapefruit is one of the biggest offenders, but I think we all know the medicines called statins, which lower cholesterol. Grapefruits can actually cause the statin level to rise. And statins, although they are fantastic medicines for preventing heart disease and treating cholesterol, can have a lot of side effects. So we really advise people not to drink. And I read different sources, a quart of grapefruit juice a day. Other drinks like orange juice are not so difficult. But this is something, again, your healthcare provider, pharmacist in particular, even a nutritionist can offer guidelines so you don't get into trouble with taking these medicines.
It's so interesting. Some of this I'd never heard before in this segment. This is fascinating. Thank you very much, Dr. Azar. For an in-depth list of the foods that may interact with your medications, just go to today.com. And up next,